Hello, everybody. Hello, welcome to Pre-Reg Shortcuts with your boy Marvin back in the house. So if you can see me, you know exactly what to do. I am excited. Are you excited? Are you excited to be here tonight? If you can hear me and if you can see me clearly, please type a yes in the comments. Type a yes. Let's do this, ladies and gents. Fumi's in the house. Yes, Fumi, how are you? The legend Fumi. Angela's in the house. Alina in the house. Amanda, how are you doing? Alexandra. Irida in the house. Yes. Iridina's in the house tonight. We've got Pre-Reg Patel. Yes, you know the score, Mr. Patel. Lala, what a name. Lala in the house. Lala in the house. Guys, I'm excited. Are you excited tonight? Because you know when Marvin turns up, you know what happens. You need to have a pen. A pen, that's a Pre-Reg Shortcuts pen, by the way. That's the key to success. And then you need to have a notebook. That's the Pre-Reg Shortcuts notebook, by the way. You need a pen, you need a notebook, and then you need a glass or a cup of water. And that's another Pre-Reg Shortcuts mug. Guys, I'm excited. Why am I excited? I'm excited because tonight I'm going to share with you some good tips that are going to help you for some of those high weighting chapters. So, hey, are we excited? Are we excited? Emin is in the house. Emin Rafik. Wow. Sana Koso. Mana in the house. Amna in the house. Wow. It is a full house tonight, ladies and gents. It's going to be good. It's going to be good because it's bound to be good when I'm here tonight. So, how's everyone doing? And where's everyone dialing in from today? Where are you dialing in from? What part of the country, what part of the world are you joining us tonight? Let me know so that I could give you a shout. I could give you a shout. I'm so excited when I see all you guys because you know that I do this for you. You know I get excited when I see you because you are all worth it, right? You're all amazing. You're worth every single second of my life. Fumi is from MK Dons. Yes, right next to me. Fumi, did you know I live in Northampton? I'm literally 15 minutes away from you, Fumi. 15 minutes. Drinks on you next time. Bolton, Manacidic. Well done, Manacidic from Bolton. Glasgow, Eminem, all the way from Glasgow. Birmingham. Everything that's from Birmingham, the lovely Birmingham. We love Birmingham. Is anyone from Liverpool? Is there anyone from Liverpool? Any Scouser in the house, mate? Any Scousers? We've got Sebilo from Coventry, Portsmouth, Daphne. Portsmouth's an amazing place. We had a GPhC session last year, and that was the first time I went to Portsmouth, and I absolutely love it. It's beautiful. But there's nowhere like London. Alexandra Tan from London. There is nowhere like London in the world. Great to have you on. Great to have you on. So, guys, welcome to the session. Is there anyone that has never, ever been to any of my sessions? If you're here today and this is your very first time you're attending a live session with me, please type a 1 in the comments. Let me give you a shout. If this is your first time, you've never seen this guy with a weird accent and big white teeth before, please type a 1 in the comment section. Great to have all of you. I'm not getting any ones. I'm assuming all of you know what I'm all about and what the sessions are all about. Oh no, we've got somebody. We've got an agent. We've got an Agent S. Agent S, big up to you. How you doing? Welcome to the show. Thank you for joining my first session, and you will totally love it, Agent S. And we've got Rauda. Rauda, great to have you as well. Welcome. I appreciate you. Thank you for turning up tonight. Ace, thank you. Ace Tuna. Oh, I just had Tuna today. So, hey, how are you, Ace? Great to have you on. Welcome. Mass Match, fantastic. Great to have you as well. So I'd like to welcome anyone that's joining my session for the very first time. And can every single person, please, guys, please join me, all of you, and just say welcome. Type in welcome to all of these 4 amazing trainees that are attending this session for the very first time. It shows you that they're determined to pass. So please type a welcome, peeps. Type a welcome to all these amazing people. Let's welcome them to the family. Let's welcome them to the session. There's 71 of us on here today. We're going to have so much fun. So For Ace, for Ruda, for Agent S, Maz, anyone that hasn't seen this program before, can you guys all see the slides? So the first slide I have on there is a reminder that this is not a one-off session. We're doing this every single week, twice a week, every Tuesday from 7 p.m. to 7:30. We've got calculations with the lovely Georgina. So please put that down in your diaries. In fact, one of the easiest ways to do this is just to hit the notification bell. Because once you do that, whenever we're live, guess what? You get a notification. So hit that notification bell. Make sure you subscribe to this channel because we are constantly coming on live and we always have a lot of great content for you. So every Tuesday, put on your diaries between 7 o'clock to 7:30. Georgina comes on here on YouTube with live calculations. So you can look at the plan right now, the program. Next week, Tuesday, the 16th, Georgina is going to be covering quantities to supply and estimation of renal function. That's what we're doing next Tuesday. Then on Wednesday, between 8 o'clock to 8:30, you have OTC. And then the following Wednesday, MEP. Guys, you don't want to miss any of these sessions. How many of you are doing your exam in June or November this year? If that's you, please type on me. Who is doing the exam in June or November this year, 2024? Type on me. Mass match. I love that name, mass match. Mass match is easy. 3 letters. Mass match, right? And the first two are the same. So literally the difference between your first name and your second name is one letter, a Z and a J. That's amazing. Mass, I purchased your standard course today. Can't wait to smash the exam. Maz, I called your family before, but now, you know what? You've joined the course. You are indeed family. You are family, part of the Pre-Reg Shortcuts because you will totally love it. And welcome. I'm glad to have you. I'll support you and make sure that you smash this exam, Maz. You are in the right place at the right time. You know the rest. Let's do this, guys. I'm excited. Who is here? Who wants to learn? Who wants some of Marvin's golden nuggets today? If you want some of my golden nuggets, my secret sauce to smash this exam, please type a 1. Type a 1. Type a 1. Type a 1, girl. Type a 1, boy. Type a 1 in the comment section. Type a 1. How can I purchase the course? Are you serious, Comfort? We're everywhere. www.preregshortcuts.com. At the end of this, I'm going to give you a link. But Comfort, we are everywhere. Just go to the website, preregshortcuts.com, and you can join the course. You might even lucky tonight. You might even win a free place on the course. I'm going to do a raffle at the end, and we're going to have one lucky winner. And the way I choose a lucky winner is the person that is the most interactive. So if you're the most interactive person today, I promise you, you will win a place on our Ultimate program. Where can I upgrade my package? People always ask me lots of questions. You can upgrade your package directly from the website. You can do that. You can upgrade it. You can send a message. Send a message to us. We're going to show you how to do that. And Mr. DX. Just put an M there and you'll be DMX. Mr. DMX. All right, let's do this. I'm excited. I'm ready to go. It is 7 of us. Let's do this together. So has everyone taken a screenshot of the plan for the next coming weeks? If you have, type of me. Make sure that you have the screen, guys. Is the screen nice and clear? Can you see everything that's on there? I just want to make sure you are ready because we're going to have a number of questions and I don't want to put the questions up and you start saying, oh my God, Marvin, I cannot see clearly. Oh my God, I'm not going to be able to answer these questions on time. So before we start the questions, I want you to be ready. I want to make sure that you can see me, you can hear me clearly, you can see the screen clearly. It's big, it's good enough for us to do this. Now, here is the good news for you. Do you guys want to know the good news? Do you want to know the good news? If you want to know the good news, type me. Type me if you want to know the good news. If you want to know the good news, type me. So here is the good news for you. In the next few minutes, we're going to do GPhC style questions. And these are questions on common areas that get tested in your GPhC exam. As all of you know, I've been doing this for more than 7 years. I've helped over 4,000 trainees pass this exam. And I'm going to show you where you need to study those common areas. So today we're going to try a few questions. They're not just random questions that Marvin has just picked up from anywhere. These are questions that have come up in the exam, not word for word, but around the same concept. So some of the things I'm going to show you as well are things from the GPhC, website, on areas that you need to focus on. So you're happy to be here tonight. You could have been anywhere in the world tonight. I would have been watching Liverpool because I love Liverpool. Any Liverpool fans in the house? Any Liverpool fans in the house? I love Liverpool. I hope Liverpool wins tonight. Okay, let's go in. Are we ready for questions? Are we ready? Are we ready? So what I'm going to do is I'm going to share with you. How many of you, okay, by the way, how many high weighting chapters are there in the exam? High weighting clinical chapters. How many high weighting clinical chapters do you have to study for the exam? Lobna, yeah, like Lobna. Lobna, you're such an angel. Lobna, you are such an angel. There are 4 topics, right? The 4 chapters. Does anyone know these chapters? Please, if you don't know, to type a 0 so I can help you. Because whenever anyone types a 0, I make sure I tell them something that changes their life, right? So type 4. So does anyone know what chapters these are? There are 4 chapters like that lovely Lobna mentioned. And everyone, the more you interact, the higher chance of winning a place tonight. So, Ivida says no. Ividina. Why did I say Ivida? Because there was an Ivida on the course that was amazing. So I always call you Ivida, but Ividina, sorry about that. Okay, Ividina says no. So Ividina, this one is for you. I'm dedicating this to you. Ivida, nice, like some people have written. Think about the nice chapters. Ividina, this is for you. Ividina, nice. Okay, just think about nice. Ividina, N is for nervous system, I is for infection, C is for your cardiovascular system, and E is for your endocrine system. Are you going to remember this now, Ividina? Let me know. Type a yes. Is that easy to remember? Just think nice. These are nice chapters. Okay, so today, the reason why I'm asking that is because, why am I asking this? Because why are your nice chapters important for the exam? Can anyone tell me why? Can anyone tell me why? Why are these nice chapters? Why am I asking you this question? Why? Why is Marvin asking us? What are the high weighting therapeutic chapters? Does anyone know why? It's because in your exam, about 65% to 70% of questions will be from high weighting chapters. Okay, or high weighting areas, right? So you're looking at between 65 to 70%. So that is a very, very high number of questions from high weighted areas. So today, this is the good news for you. So the good news for you is we will cover today some high weighted areas, which means you may see some of these questions in your exam in November or in June this year. Okay, so this is how important this session is. Okay, let's go. So let's start with the cardiovascular system. Does anyone want me to give you a sort of prediction, the areas that get tested the most from the cardiovascular system? Those of you on the combo course, you know all of this stuff because we've covered it. I've gone through this. I've taught you this stuff. You know this stuff. But perhaps there are a few people here that are not on our course. So perhaps you want to learn this stuff with me now. Does anyone want me to show them? Type a yes. Thank you, Ravina. A longer yes is even better, isn't it? So if anyone wants me to show you those areas that you need to focus on when it comes to the cardiovascular system, please type a yes. This is huge. This is huge. So it doesn't mean these are the only areas questions are going to come from. But from my experience, these are the most common. So whatever you do, make sure you learn these areas. And I always have a formula for everything, and a mnemonic, like most of you know, because it helps you with your memory, and that's what I do. So the formula is HAS. And those of you on the course, you know exactly what this is all about. And those of you that put yes, you didn't know, you wanted me to share this with you, perhaps Fumi or Fozia or Ruwaida, Agent S, Brijesh Patel. Just remember HHAASS. These are 6 key topics that generally come up the most from the cardiovascular chapter. And if you don't do anything else, you don't take anything away from this session, the one thing you need to take from this session is HAS. Now the question is, what does HAS stand for? What does it stand for? So you got 2 H's, you got 2 A's, and 2 S's. So what do they stand for? What do you think the first H stands for? One of the most common areas that get tested in your exam. You need to learn this stuff inside out. Inside out. Who wants to write down what the first H stands for? Where are my people? Where's my family? Where's the Pre-Reg Shortcuts family? Where are you? Where are you? Answer this question. Yes, I've got hypertension. Thank you very much, Fozia. Kieran, hypertension. Make sure you learn everything when it comes to hypertension. Inside out, your algorithm, the guidelines, everything. And we're going to have some questions today. Right? The GPhC loves to test you on this. And as pharmacists, you really want to be up to date when it comes to hypertension, guys. You have to be. So what's the second H? What does it stand for? The second H stands for brilliant. Heart failure. So now we've got 2 H's. We've got hypertension and we've got heart failure. Whatever happens, make sure you learn the stuff inside out. Okay, what about A? What does the first A stand for? The first A, what do you guys think? What is the first A? What is the first A? Let's see. Remember, whoever interacts the most will win a prize tonight. So, first A, Daphne, you are a legend, girl. You are one amazing girl. Atrial fibrillation, right? Your AF, arrhythmias, all of that stuff. That's the first A. Learn your arrhythmias inside out. Rate control, rhythm control, all of that stuff. We'll cover all of this in detail on the Pre-Reg Shortcuts course. Okay, what about the second A? What does the second A stand for? What does the second A stand for? So you got one A, which is AF. Well done. Well done. Well done. But what is the next one? I want to see the next one. Well, hey, hang on a minute. Who's on the Pre-Reg Shortcuts course? Who is on the Pre-Reg? Please, you need to answer this stuff. Don't let me down because we've done this. This is the one formula you always have to learn before you start reading the cardiovascular system. You need to know this. So the second A is not angina. Again, I'm not saying that questions don't come from angina, guys. Please don't get me wrong. What I'm talking about is the most common questions, right? So you get most of the questions, it's anticoagulants. Anticoagulants, guys. You generally have questions in almost, if not every single exam. You're going to have questions on anticoagulants. It will either be DOACs, such as your rivaroxabans, your doxabans, your apixabans, your dabigatrans, or it will be on, say, warfarin, or perhaps your heparins. But you will generally get questions on anticoagulants. They love to ask you questions on anticoagulants. Okay, so we've got the 2A, so we've got 2 H's, we've got hypertension, we've got heart failure, we have anticoagulants. So let's see, what is your S? What is your first S? Anticoagulants and AF, the 2A. So what's your first S? Agent S is asking, is anticoagulants not linked to AF? It is linked to AF, but they're different, aren't they? Right, so it is linked because everyone that's got AF has to be assessed for the risk of stroke. Right? They need to be assessed. Every single person that's got atrial fibrillation has to be assessed for the risk of stroke and the risk of bleeding. So that's how this is connected together. So they're not the same, but yes, you have to connect them together. But you're going to be asked questions on AF. There are many different questions that you could ask on AF that have nothing to do with anticoagulants. And then you have questions, loads of questions that could be asked on anticoagulants. Okay, great. Statins and stroke. Statins and stroke. So there you go, guys. There you go. So the HAS formula is one of the first things you want to learn. Please let me know if the slides have changed because I need to switch between screens. Has that changed? CVS prediction, the HAS formula. Type R yes. No, type a 1 if that has changed. You're actually on my CVS prediction formula. Type a 1. Type a 1. Help me out. Let me make sure the slides are changing. Let me know. Yes, 1. Fantastic. Thank you. We're going to have a great evening. So here's your formula. Please take a screenshot, do whatever you want, but make sure. What do you have to do with this stuff, by the way? What you have to do is these are not the only areas where you're going to get questions from. Please don't get me wrong. You could get on angina and different topics, but what I mean is these are the most common areas. So whatever you do, make sure that before your exam, you've learned these ones inside out. You've learned these topics inside out to increase your chances of totally smashing this exam. Okay, great stuff. So, are we excited to start questions? Who's excited? Type of me, type of me. If you want some questions, type of me, type of me, type of me, type of me. If you want to go straight into questions, we're going to do questions under time conditions. I'm going to give you 1 minute. But hey, here's the thing. In order to pass this exam, you need to have the knowledge and then you need to apply the knowledge. Right? Before you answer questions, you need to have knowledge. So I love teaching you. I love teaching you concepts. I love teaching you strategies. I love making sure you understand things before the actual questions. So before we go into the questions, I want to show you, this is my prediction. I want to show you what the GPhC, this is from the GPhC, not for myself, wants you to focus on when it comes to the cardiovascular system. How many of you want to see what the GPhC needs you to focus on? And every single time, by the way, the GPhC has put this out, they will test you on these things. They don't put them out there and then don't test you. They say, hey, listen, these are the areas, I really want you to focus on these areas when you're revising. Not exhaustive, doesn't mean don't focus on anything else, but we tend to ask you questions from here. So once you're revising, make sure you learn these areas. Who wants to see the GPhC areas? So that once you start your revision, you make sure you learn this because the general come up your exam. So let's change this for you. Someone says it's a bit blurred. Is it blurred? Maybe I'll take my video off. Sorry about that. Can you guys hear me and can you see me? Please type a yes, because for some reason my screen just disappeared. I don't know why. I don't know what happened there. Can you guys all see me? I need to bring the slides back up. Sorry about that. I don't know what happened then. Okay, let me bring that back up. Ooh, that's weird. Okay. Can you guys still see me? Please type a 1, because for some reason my screen just went off. Can you guys still see me? Yes, that's very strange. I've never had that before. Never had that before. Someone doesn't want you guys to do these questions. Okay, so let's go in. We're going to the question. I've set my timer. You've got 1.5 minutes, and then please don't type your answer in the comment section. If you have an answer, please just hold it. Those are the rules of the game. Don't put an answer down until I ask you for the answer. Okay, no answer until I ask you for the answer. All right. Okay, let's go. Question number 1. And I'm going to set my timer. You have 1.5 minutes to answer this question. Don't put any answers down until I ask you for the answer, and then we're going to go through the answer together. Simple rules. Okay, question number 1. Let's go. Oh, sorry. Sorry, my bad. I had something else for you. Sorry, before you get too excited, I just noticed I had another slide for you, which is again the common areas that the GPhC wants you to learn, because this is so important. I missed one slide out, but this is so important for you. Okay, the common areas are more with anticoagulants, because you always get at least 1 or 2 or 3 questions on anticoagulants. A key area that generally comes up a lot is important pump interactions with OTC. So, for example, one that's come up quite a lot is warfarin and metconazole. Right, so any prescription-only drug that interacts with an OTC medication or a PMED, please learn these inside out. Right, I love asking those questions. And then side effects, how to recognize side effects, how to manage side effects. If someone is on digoxin and maybe they've got the experience some of the side effects of digoxin, some nausea, some vomiting, some yellow eyes or things, what do you do? Counseling on effective use of anticoagulants. So counseling, for example, on warfarin. How do you use warfarin? What time of the day? Any advice? What do they have to eat? What do they have to be cautious about? So counseling on your anticoagulants. Indications for different anticoagulants. So indications for warfarin, indications for heparin, indications for rivaroxaban, indications for apixaban. So you need to know your different indications. And then the dose and the duration of treatment for different indications. Again, this is from the GPhC, okay? Not for me, this is from the GPhC. So make sure you take a photo of this, because this is from the GPhC, and this is from the GPhC as well. So I think that's the last slide before the questions. Are we ready for the questions? Are we ready for the questions? Type a 2 this time. Let me make sure. What about antidotes for DOACs? Yes, antidotes as well for DOACs. So everything anticoagulants. You've had lots of questions on antidotes for DOACs. So please learn your antidotes. Generally, anything with anticoagulants. Okay, so this is definitely going to be a question. So question number 1, my timer is ready. I'm seeing lots of 2s. So fantastic. Question number 1. You've got 1.5 minutes. Okay, what your answers, ladies and gents? What answer did you guys get for that question? This is one question that has come up a few times. That's your timer. That's your timer. What answer did you guys get? So I'm getting different answers. I'm getting C. I'm getting Candle Saturn. D, B, B, B. Interesting. We've got quite a diverse range of answers. We've got A, B, wow, what else have we got? D. Fantastic. I love it when we have different answers because that means we can't all answers can be correct. So that means many of you are about to learn something new, which is very good. This is why you're here. All right, this is why you're here. So let's look at what answer this is. All right, so those of you, I'll show you guys techniques, which I'm going to do later on when we have more sessions. I'll teach you how to answer GPhC questions using very good critical thinking strategies. So let's do this question together, right? And let's see what the correct answer is. So this patient, when you have any of these questions, anytime the GPhC gives you questions, you're going to have what we call a scenario, which is this. This is your scenario. You're always going to have a scenario in each question, well, single best answered question. You're going to have a scenario. Then you're going to have the question, which is this. This is how you need to break this down. Then you're going to have the question, which is this part over here. And then you're going to have your options. Generally 5 options. They're normally in alphabetical order, but I've not put that in alphabetical order. But in your exam, you're going to have a scenario. Then you're going to have the question. Then you're going to have 5 options. So this is how you answer these questions. You need to first look at the person. Right? The GPhC is going to ask you questions. They're going to test you. And the first places to look, I use something called GPS Disco. But one of the things we'll look at is, which I could teach you guys later on. But for now, you look, is it a male or a female? Is it black? Is it white? Is it Caucasian? Is it a child? Is it an elderly patient? In this case, it's a 60-year-old lady, but the lady is Black African. This is very, very important, and I'll show you guys why. So you need to highlight this Black African female who has been diagnosed with hypertension. You need to put down any conditions, highlight any conditions you see in a question. So we've got hypertension and we've got diabetes. When you do this method, I'll show you guys how to answer questions. You need to highlight certain things because they're going to help you at the end, right? So we've got she's currently taking metformin, diabetes twice daily for diabetes. Her GP has decided to start her on a stepwise management for both conditions. So that's the scenario. Now we're looking at which of the following medications is the most appropriate first step for hypertension. This patient is also 60 years old. So here are the most important things. We've got 60 years old, we've got Black African, we've got hypertension, we've got diabetes, and we are referring to the hypertension guidelines. So important. We're not looking at anything else. We're looking at your hypertension guidelines. So when I showed you guys previously, one of the areas the GPhC needs you to learn is learn your guidelines. And this is one of your HAS questions. This is H for hypertension. So normally this patient is 60. So any patient that is above 55, we want to give them a calcium channel blocker. We're going to work through the process of elimination. So who put down A as an answer? If you put A, type of me, type of me, type of me. If you had A down, type of me. I'm Lord of Pain. If that's you, type of me, type of me, type of me. Because if you put down A, then you're totally wrong. We don't have Bendro, right? So Bendroflumethiazide at 2.5 is for hypertension, but with your guidance or your guidelines, your algorithm, we don't really give Bendro because they could affect your electrolytes very much. So we give something else. Does anyone know the 2 most common blood pressure tablets that we give for hypertension, the recommended for hypertension? Does anyone know? Type it in the comment section. The 2 most common hypertension medications. So Bendro 2.5 could be used for hypertension, but not Bendro. What we got. I'm going to come back to that. Great. So let's look at the guidelines. So according to your guidelines, we will go for a calcium channel blocker. Type a yes if that's correct. We will go for a calcium channel blocker. However, and this is what we need to do. By the way, I was looking for indapamide and clothalidone. Right, I was looking for indapamide and clothalidone, but hang on. So we've got this. We would normally go, because patients above 55, we would normally go for a calcium channel blocker. But the reason why we're not going to go for a calcium channel blocker is for one thing. This patient has diabetes. If this patient did not have diabetes, then the answer will be A, right? Because that's the normal algorithm. So be very careful. Those of you that got this wrong, please learn this stuff. So because this patient is diabetic, regardless, any patient that's diabetic, you need to start them either on an ACE inhibitor or an ARB, right? So these are the two medications which we are looking at. Propranolol, no, we could eliminate first. So propranolol. So we're left with candesartan, which is an ARB, and lisinopril, which is an ACE inhibitor. We could give either or. Another thing we need to look at this question is the patient is Black African. So according to your guidelines, only if the patient is diabetic and Black African, it has to be both, then the preferred first line is an ARB over an ACE, which means the most appropriate answer will be B. So anyone that put B down, well done. So the correct answer, ladies and gentlemen, is B for candesartan, because it is the most appropriate, and this is according to your guidelines. Is that clear? Type of one. I know many of you, some of you got that as well, which is good. I've got Fosia, ARB preferred over ACE. If they're Afro, correct. That's very important information. You need to learn. It does come up in your exam. So please know the difference. But the person has to be an African Caribbean with diabetes. Okay, so it's with diabetes. Okay, so please learn this stuff. In fact, any patient with diabetes, right, if they've got hypertension and diabetes, it's an ACE inhibitor or an ARB. But if that patient is Black African, then an ARB is preference. Great stuff. So let's go next question. Put the timer back on. You guys are doing very well. Question number 2. So question number 2, let's go. And you've got 1 minute and a half starting now. Okay, let's have your answers, ladies and gents. Let's have your answers. Let's have your answers. Let's have your answers, ladies and gents. Let's see those answers. So I'm getting D for 6. D, I'm getting another D. Getting 6. Lobna says 5. Where is E? Did I miss? Why do I only have A, B, C, D? Gosh, I think I missed an E somewhere. That's not fair. Sorry about that question. We're going to do the question anyway because the answer is going to be there, but I'm missing an E. You normally have 5 options. Okay, what we got? We're getting 6, we're getting D, we're getting D, we're getting A, we have C, which is 3. Great stuff. Fozia, we have 8. A, right, 8A. Okay, great stuff. So let's look at this together. So this is another question that's come up before in your exams. You need to know your CHADVAT score and how to work your CHADVAT score out. You also need to know what the different things stand for, the different letters in the score. Okay, so let's work this out together. So this patient is 78 years old. What is the CHADVAT score if the patient is 78? Let's see what you guys have. We'll work that out together. 2. Okay, great. I'm getting loads of 2s. Fantastic. So let me go to this slide. It will make more sense to those of you that did not get this right. Okay, so that's the table, and these are your scores, right? These are your scores. So we'll do this together. Whenever they give you any question on the CHADVAT score, an area where many people get wrong, please always start off with the sex, because many people forget that being a female is 1 point. Right? If you don't do that, you'll be looking at everything else, but you forget that the very fact that this is a lady, that's 1 point. So we're going to start with 78. The patient is 78. Anyone that's above 75 years old is 2 points. So we have 2 plus. Okay, so 1, 2 already. So a lady, that's a lady. 78 is 2, and being a lady is 1 because the sex is female. So we're going to have 1. Okay, 2 plus 1. Has recently come into your GP practice that she wants to assess her risk of having a stroke, right? She's living with multiple comorbidities, including hypercholesterolemia, type 2 diabetes. That's another one. Diabetes is 1. So we're going to put plus 1. Take your time if you get questions in CHADVAT. Don't rush it. Just take your time. Every single word, stop. Hypertension. Ooh, hypertension. That's 1. Let's add hypertension to it, okay? Because you can see over here, H, hypertension, and peripheral arterial disease. This is a vascular disease, or peripheral arterial disease. So that's another 1. That's how you answer these questions. You go step by step, but make sure you don't forget the female, because many people just go, oh yeah, congestive heart failure, blah blah blah, and then forget, oh, it's a lady. Female has got 1 point. If it was male, then it's 0. Okay, males have no points. So we've got 2, 3, 4, 5, 6. So anyone that put D, and there you go, I've got E now. I don't know why I missed that E previously, but thank God that wasn't the correct answer. So the correct answer, which many of you got correct, is D. D6. So type of 1, if that's clear, type of 1, type of 1, type of 1. So the correct answer is 6. Learn your table and learn your points. So the correct answer is 6. By the way, who's enjoying the session? If you're enjoying the session and you're learning, type of me. And if you want me to keep going with another question, type of me. Someone says, oh, Marvin, oh, so how do we memorize this stuff? You memorize it through the formula. Eva, I'll show you. Oh, I almost ended the stream then. Not yet. Okay, let's, Eva, one of the good ways you can memorize this stuff is just learn CHADVASC. Okay, learn CHADVASC. Oh, that's not the one. Right, learn CHADVASC and just learn CHADVASC. So C is for congestive heart failure, H is for hypertension, but A2, so put 2s there. So CHADVASC, A2 and S2. That's going to help you because you know the 2 A's, which means the 2 ages. A if it's above 75 and another age if it's between 65 to 74. The one which is A2 is 2 points, and the A which is just 1A is 1 point. Same, D is for diabetes, S is for stroke or transient ischemic stroke, heart attack. All of this is an S2, right? Not heart attack, so transient ischemic attack, right? So that's 2, and then vascular disease, age, You just have to memorize this, right? Just learn ChatVask and then you'll be able to do this easily. Okay, is that all right, Eva? Is that okay? Right, thank you. What about orbit and Hasbled? Yes, you need to learn those too. Sorry about that. I think you guys missed something. You couldn't hear me. So, can you guys hear me now? Or is there still no sound? Can you hear me? Can you hear me? Please say yes. That's weird. Yes, okay, you can hear me. You can hear me. 102 of us on here, so you guys need to hear me. All right, so is that clear? If this is clear with the chat verse, type of me, and I can move on to the next question. Type of me if that's clear. And someone asked about orbit and Hasbled, and I said, yes, you need to learn these as well. So with ChatVast, that's to assess your risk of stroke, but you also need to assess your risk of bleeding, and you use orbit and Hasbled, also learn these. Okay, let's go to the next question. Let's go to the next question. Let me take this off. And these are all questions that come up in the exam, GPhC questions. So here is your next question. Let me set my timer. You have 1.5 minutes again for this question. All right, your question starts now. Okay, what's your answer for this question, ladies and gents? Answer, what's your answer? What's your answer? Type your answers in. Type your answers. Type your answers. So I'm getting different answers. I'm getting E, I'm getting D, I'm getting E and C. I've got C over here. So I'm getting different answers. Right. Okay. Let's look at this together because this is, again, another one that gets tested a few times. Let's do this together. By the way, guys, can you do me a favor, please? Can you do me a favor? If you're enjoying the session, please hit the like button. Right? You've got the like on your screen. Please hit that like button. Please, please, please hit it for me. Please do that for me. Just hit the like button. All right? Hit that like button on your screen. Why? Because that's going to help this video to reach more people. Okay, so please help me by just hitting the like button if you're actually enjoying this and you want me to do more of these sessions. Great. Thank you, Fozia. Thank you so much. I appreciate that. Thank you, Evidina. Thank you for supporting my channel. Thank you so much. Thank you, guys. I appreciate that. I appreciate that. So let's look at this question together because it's a very, very important question that does come up. Anytime you see a Pixaban, you need to remember this. Fozia says, your video is amazing. Thank you, Fozia. That means a lot to me. Appreciate it. Thank you so much. Okay, so ladies and gents, let us go to something. Okay, now, anytime you see a Pixaban, There are 4 DOACs. There are only 4 DOACs. What are the DOACs? If you know them, type them down. If you don't know your DOACs, type 0. There are only 4 DOACs. If you don't know them, type 0 and I'll help you. If you do, you could type the DOACs down. All right, let's see. Read, Famida, well done. You could tell Famida is on my course. She's been using my notes because that was one of my mnemonics that I put together. Read. Everyone's using it now. Everyone's reading my mnemonics and they're using it. They're very good. I love it. That's why I love teaching you guys mnemonics. So some of you are putting down 0. Iridina, today is your lucky day. Iridina, you're in the right place at the right time with the right person. Okay, here we go. So we've got read because someone just said read. So you only have, which makes life easy, 4 DOACs, okay? Direct acting oral anticoagulants. The R is for rivaroxaban, E is for edoxaban, A is for apixaban, and D is for dabigatran. Read. Easy to remember. What you want to do is you want to circle this together, the first 2, and then you circle the last 2, okay? And underneath here, you write 1, and underneath here, you write 2. Okay, this means rivaroxaban and edoxaban are given once a day, while apixaban and dabigatran tend to be given twice a day, right? Read the once a day, RE, and AD twice a day. Is that right? Type of 1, if that's clear. Type of 1, type of 1, type of 1. Type of 1, right? So you need to know this stuff. Why do you need to know this stuff? Because it's going to help you when I teach you guys how to answer questions using a process called the process of elimination. It's a very powerful technique of answering GPhC questions easily. And it helps you, even if you don't know the answer to the question, you actually get it right just by using the process of elimination. So by using the process of elimination, even before I read the question, even before I look at the question, I can start eliminating the right answer, even without looking at the question. Here's what we're going to do. So read has to be taken once a day, not twice a day. I'm going to look at that question. It has nothing to do with the others. It has only apixaban, which is good for us. Okay. I don't even need to read the question. I just need to use my process of elimination. So straight away, I know this has to be twice a day. So any option which isn't twice a day, I'm going to just take it off. And that's all you have to do. In the exam, do that. Process of elimination first. It has to be twice a day. So we've eliminated A and D. So we only have B, C, and E. This could be the only possible correct answers. So patient is 80 years old and someone mentioned something with apixaban. You need to learn your A, B, C's of apixaban. And this is only for apixaban. What does this mean? This simply means that apixaban has a normal standard dose. Okay, so for a patient requires a prophylactic therapy for stroke. So this is prophylaxis is different from a treatment dose, and you need to know the differences. But this is prophylaxis. Now, for prophylaxis, the normal dose is 5 milligrams twice a day. So if you knew that for your prophylactic dose, you generally take this off because it's not 10, it's 5. So we're left with C or E. This is where you need to know about your ABCs of apixaban in order to know which is the right answer between these two. Now, according to the rules of ABC, and this is only for apixaban, by the way, whenever you see a prescription of apixaban, you need to look at 3 things. And if the patient has 2 of these out of the 3, you need to halve the dose. You need to halve this dose. So this dose has to go to 2.5, right? So if the patient on apixaban has 2, it has to be 2 of these ABCs, then you halve the dose. So knowing that, let's see what is the ABC of apixaban. Here is what it is. So this may not look as big. I don't know if you guys can see that properly, but the first one is age. If the patient is above or equals to 80 years old, anyone that's 80 and above, and this patient's 80, so we're going to put A. We're going to put A, which means that we've got A already, correct? Boom. We're going to look at B because you need to have at least 2 in order to reduce that dose for the patient. So what's the second one? The patient weighs 60 kilograms. It says any body weight that is 60 or less than 60. 60 and 60. Wow, we've got B, right? So B is for body weight. A is for age. B is for body weight. We already have 2 all on there. So we don't even need to look at the third one, C. We don't even need creatinine levels. Just with having this 2, it means we qualify. It is time to reduce this dose from 5 milligrams to 2. This leaves us with only one correct answer, which is E. Because it's apixaban, because the patient has 2 of the ABCs, has 2 of these, then we have to halve the normal dose by half. And that gives you 2.5. Is that clear? Type of 1, type of 1, type of 1. Type of 1, type of 1, type of 1, if that's clear. Type of 1 is, so Jay says, what's blood waffling about right here? Blood, what are you waffling about right here, Jay Blood? It's always interesting when you have like random people come up like Jay. Yes, Jay, I'm waffling. This waffling is what gets us to pass. Is anyone enjoying the waffle and learning something new? Type of me. Jay Blood in the house. Jay Blood. Yes, Blood. So great stuff, guys. If you guys are understanding this stuff, I'm loving it. I'm here to make sure I help you learn. So well done. Well done. Great stuff. We're going to take time to make sure enjoy 100 of us on here. Fantastic. Okay, so are we ready for the next question? If you're ready for the next question, type of 1, type of 1, type of 1. Who is a big fan of the waffle? The biggest fan of waffle is Lovna. Yes, we love to waffle that way. Waffle gets you to pass, right? This is what I call taking time to explain everything as simple and detailed as possible. No assumptions. I love it. Great. So next question. Are we ready for the next question? Lovely people. By the way, I appreciate all of you being on here. I really appreciate you taking the time to be on here. And I hope you are learning quite a lot from this session. Okay, so next question. Are we ready? I'm going to get timer back on and we're going to smash the next question together. So next question. Let's go. And your 1.5 minutes starts now. Okay, let's have your answers. Let's have your answers. Wow, guys, I'm really impressed because no one actually puts the answer down. I'm really impressed by how you guys follow the rules. Thank you so much. There's about 100 of us on here, and you all actually follow the rules. That's impressive. That's impressive. So, what is the correct answer? Let's see your answers. Let's see your answers. Let's see your answers. What is the most appropriate answer? So I'm getting E, I'm getting E question mark, I'm getting E, I'm getting E, I'm getting C, C question mark, E. Wow. Different answers. Brilliant. Brilliant. Well, it looks like most of you are putting E down. So let's look at this question. Let's look at this together like we always do, So let's look at the question. All right, so we've got the patient. Literally, we could go straight into this because we know the question is asking about a patient coming to collect a apixaban prescription. Patients ask for more information. Which of the following statements regarding the direct acting anticoagulants is the most appropriate? So let's go through the process of elimination, which means we take away in the exam, just rule out the first thing that you think this is a definite no. So let's look at what we can rule out straight away. Dabigatran and rivaroxaban are direct inhibitors of factor XA. Who thinks this is correct? Type 1. Who thinks that's correct? Who thinks that's wrong? Type R, wrong. Who thinks that's wrong? So this is not correct because rivaroxaban is an inhibitor of factor XA, but dabigatran isn't. So this makes this option wrong. So the next one, rivaroxaban should always be taken with food. This could be correct. Let's put a question mark. We'll come back to that one. Next one, patients on DOAC should be advised to avoid excessive consumption of vitamin K. We're going to rule that out straight away because this is warfarin, not DOACs. DOACs have nothing to do with vitamin K. That's for warfarin. The antidote of rivaroxaban is idarucizumab. Someone spoke about antidotes. The GPhC loves to ask you questions on antidotes. What is the antidote for rivaroxaban? What is the antidote for rivaroxaban? What is the antidote? If you don't know, put a 0, by the way, and I can help you. I'm here to help you. Right? What is the antidote for rivaroxaban? Yes, it is andexanet alpha. It has come up a few times in the GPH exam, right? Andexanet alpha. Roweda, please learn this stuff. It has come up a few times in your exam. It may come up again. I have little strategies and techniques that help trainees to remember that. But it ends with AN, right? Rivaroxaban and andexanet alpha. And andexanet alpha. Okay, so because of that, this is wrong. So we're left with two options now. Either E could be the correct answer or B could be the correct answer. Now, this is what you have to be very careful about. Some of you said, oh, it's B and E. Oh, they're confused. The reason, what is the correct answer? The correct answer is E. You don't need to monitor INRs with DOACs. INRs are only for warfarin. You don't need to measure any INRs when you're dealing with DOACs. And the reason why this is wrong as well is because it says rivaroxaban should always, this word is what makes the sentence wrong. It doesn't always have to be taken with food. Only the high strengths, 15 milligrams and 20 milligrams. Only the 15 and 20 milligram tablets have to be taken with food. The others don't have to. You could if you wanted to, but they don't have to be taken with food. So rivaroxaban 2.5, you don't need to take it with food. Rivaroxaban 5, you don't need to take it with food. Rivaroxaban 10, you don't need to take it with food, but 15 and 20, you do. So this makes the sentence wrong because the sentence says always. Is that clear? Type of 1, type of 1. Is that clear? Type of 1. Type of 1 if that's clear. Great. Yes, so all of them are wrong except one. That's why the question is, which of the following statements regarding DOACs is the most appropriate one? The right answer is E. Monitoring of INR levels with a DOAC is not required. That is the most appropriate. That's the correct answer. In fact, maybe I see what you guys mean. Maybe I should change that. I should make it clearer. Perhaps I'll say which is the correct answer. Then you guys won't get confused with the most appropriate. Maybe I would have changed that to what is the correct sentence, right? The correct statement. So yes, I get it. I get where some of you are like, oh, that's a bit confusing. But the main thing is, remember, no INR for DOAX is the correct answer. No, I didn't cross ER. Well, I wasn't really crossing ER as the wrong answer. Sorry, I was just showing you that this is the correct answer. So I cross all the others. All right, wow, you guys. All right, let's do this. But I see me, oh my, you're confusing me with crossing everything. So I'm going to take this off. I'm not going to cross it. Sorry about that. So this is your correct answer. Is that okay? Is that clearer? So I've crossed out all the others, and I'll cross this one out just to make sure that no one else is confused. Your correct answer is E. Is that clear? Okay, great stuff. So I think it's the last question because you guys need to go. I think we need to end now. I don't want to take all your time. Do you guys want to have a last question or do you want to end now? I'm very impressed. There's about 100 of you that have stayed on here. It is impressive. It's impressive. Got too carried away by fun. How many of you had a great time? How many of you enjoyed the session? If you enjoyed the session, type of one. If you want me to give a last question and then to get a winner. So I've got one more, Marvin, one last one. Wow, you guys are, wow. Do you know what? Do you know we've been on here for an hour, almost an hour and 15 minutes? How many of you felt the time just went so fast? We've been here for almost an hour and 15 minutes, guys. And you've worked today, you've had a long day at work, and you've come back home and you've been on here. So I'm very impressed with all of you. Thank you so much for your time. Thank you for your patience. Thank you for your interaction. Thank you so much. Okay, so let's do the last question. The last question. So your 1.5 minutes starts now. Oh, I think I'll have to stop here because I was going to give you a little lesson about areas that get tested on insulin, but we don't have enough time for me to go through everything with you. So why don't we do this? I'll just give you a question to answer. So let's just do this question. So it's insulin now. It's the endocrine system or the endocrine system. All right. So you've got 1.5 minutes to try to answer this question. Another high weighting question that comes with quite a lot. So what's the answer to this question? We'll do that one quickly. What is the answer? All right, let's see. So loads of A's. I've got A's and E's and A's and E's and A's and E's and A's and E's. Loads of you are writing A, E, A, E, A, E. Okay. All right, let's see what's the answer. What's the answer to this question? What's the answer? We've got A, we've got E, we've got A, we've got E, we've got A, we've got E, we've got A, we've got E. Okay, let's go, let's go, let's go. So we're looking at a 65-year-old patient with diabetes. Has recently been diagnosed with congestive heart failure. Considering the comorbidity, what would be the most appropriate first-line treatment for glycemic control in this patient? So which one would you guys go for? Which one will we go for? Let's go into an explanation for this. So you need to know your guidelines, right? You need to know your diabetes guidelines, and it's so important because that got updated not too long ago. This question comes up. You have a high chance you always get questions on insulin or diabetic questions. So watch out for this question. Okay, watch out for this. So this patient, let's go into this. Let's go into the question. This is your guideline you need to use, and make sure you learn this. So patients, you have that all explained for you, right? So all patients that are diabetic, you need to assess them for the cardiovascular risk. So if the patient doesn't have a CVD risk, then you offer them metformin. You offer them metformin if there's no CV risk. So just diabetes, no cardiovascular disease. If the patient has got chronic heart failure, then you offer them metformin. And as soon as metformin is tolerated, then you offer them an SGLT2 inhibitor. For example, E. So it cannot be anything else but E because that's the only SGLT2 inhibitor. So in this scenario, this is quite interesting because the first line of this will have to be metformin. So although you have E in practice, you will definitely have metformin. And then as soon as the metformin is tolerated, then you will start E. So these are the two drugs that you want to give this patient, right? So you give them metformin. As soon as metformin is tolerated, it's confirmed, then you offer them dapagliflozin, right? So that is the correct answer. So this is your next line, like the second line you add to the metformin once that settle, but you always start off with the metformin first. Give the metformin, let that settle, and then add this medication for this patient, simply because the patient has got congestive heart failure. Is that clear? Type of 1, type of 1, type of 1, type of 1, type of 1. So metformin first, make sure it settles, the patient settles, it's fine with metformin, and then you add your next medication. Absolutely important. Absolutely important. What about the risk of lactic acidosis? That's fine. This patient perhaps had some sort of renal impairment, then we're going to watch out for that. So I did a question. It's interesting because I did a question in the class. Most of you might have seen this question and go, oh, Marvin, that's a bit different. Because in the question, I changed that from the question we had on the course. Because in our question, I had renal impairment, right? I had a renal impairment there. So we jumped metformin and we went to dapagliflozin. What I've done this time to trap some of you, I've taken out that renal impairment just to see whether you're going to know it is metformin first. Okay, does it have to be DAPA? No, it could be any. It could be any. It could be any. It doesn't have to be DAPA. I've just put DAPA this time. Okay, so yes, so if they had renal impairment, then you don't want to give metformin. And well, you have to give an EGFR. If the EGFR is less than 30, then you don't really want to give metformin. In that case, you just go into your DAPA. Great stuff, great stuff. So is that all clear, people? Is that all clear? Sorry, I could go on with you guys. We could have full sessions on the course. I do sessions about 2.5 hours, and people think it's just been 10 minutes because that interactive, there's so much energy, there's so much learning, there's so much interaction, and we highlight things. So I'm going to have a winner because you guys have done so well to be on here. So thank you so much. I'm going to have a winner. I'm going to pick one of you. A lucky winner today is going to win a place on our program. You're going to have access 1 week. You're going to have 1 week access to our standard plan. And this plan gives you everything, all the clinical, all calculations, all MEP, all OTC, and you can join some of my live sessions as well. So it's going to be great. You'll love it. Also, if you wanted to speak to us about the course, if you're interested in joining our program, in the description of this video, there is a link. You can click on that link. It's a WhatsApp link, right? And you can chat to us. So How many of you enjoyed the session and you love me to do more of this? If you did, let me know. Type in the comment. If you want me to do more sessions like this and you enjoyed it, please type a yes in the comments. Type a yes. So I'm going to get a winner now. Go into the description of this video. There is a link. If you want to chat to us, you can send us a message directly on WhatsApp if you're interested in the course. I also do lots of sessions on Insta. Many of you follow me as well on Insta. Lobna says, Marvin, I won on Insta for contraception, but I don't know who to speak to get access. Oh, Lobna, yes, you did win last time. Lobna, please, for you have to email Uma, okay? Or send me a message. Send me a message on LinkedIn, all right? And we'll get you in. Right, great. Who is going to be our lucky winner tonight? Who's ready? Who's feeling lucky tonight? I've got to pick a lucky winner, someone that has been very interactive, that has been engaging. I felt your energy. In fact, all of you deserve to win. Okay, everyone has been engaging. Everyone has been interactive. I've really enjoyed this session with you guys. I wish I could get all of you as winners, but unfortunately, I cannot get all of you as winners. I have to choose one winner today. So who am I going to choose today? Who has been so interactive? Who has been so interactive? So the person I'm choosing today is none other than Agent S. Agent S, and I need to get your real name, but you've been quite interactive. So Agent S, we need to know your real name. So what I need you to do is I need you, Agent S, to send an email to Uma at Pre-Reg Shortcuts.com. Agent S, send an email to Uma, I've just put that in there, at Pre-Reg Shortcuts.com, and tell Uma you just won a place on the YouTube live today. So Uma at Pre-Reg Shortcuts.com, send an email, Agent S, you are the winner for today. And we're going to do another session. Guys, remember, we're going to be doing this every week. Next week, we've got calculations on Tuesday from 7 to 7:30. And then you're going to have OTC on Wednesday. So Tuesdays and Wednesdays, please come on here and have a great time. Thank you all so much. And the final thing I have for you is, again, those of you that are interested, you want more information, I'm going to jump over these questions because we just didn't have time to do them. But any of you, that's the website, www.prewshortcuts.com. You could go into the website and you just click on preview courses and you can see all our courses. We've got an amazing pass rate. As you can see, 9% pass rate, over 4,500 trainees. There's over 10 courses on our website. And you also have a free version. You could have a free course on there to see what it's like. We have an amazing question bank with over 1,000 questions. So there's just so much on the website. In terms of Trustpilot, we have over 263 reviews, and this is an excellent rating of 4.7 out of 5. So please, if you're interested in learning more, you enjoyed the session, you want more of this stuff, you want to learn about the program, all you have to do is go to this website, okay, www.prewshortcuts.com, and you get so much information. If you wanted to speak to any of us, go into the description of this video. There is a link for WhatsApp. Send us a WhatsApp message and we will chat to you directly. Okay, thank you all. You've been great. Have a lovely evening. And I look forward to seeing you all again soon. Have a great time. Thank you all. You've all been fantastic. See you all soon. Bye.